position in Cape Town. So I paused. My boss was not amused, but he needed a pediatric ophthalmologist in KCMC. So he told me, look, I will allow you to go and do this fellowship so long as you will run the pediatric clinic as you do your retina fellowship, which was a lot of work. My wife tells me that she never used to see me. It was very, very tough. But I said, if that's what it takes, that's what it takes. So I went to Cape Town. I left my wife and kids in Moshi. My wife is a stay-at-home mom. She's a pharmacist, but after her second born, she decided to stay home. So we just landed in Moshi, and the only thing they knew was the church, the supermarket, the bank, and the bakery. And so I left her with 3 small kids, took off to Cape Town, and I must really, really just give honor to my wife, because that was a big, big sacrifice. So I went to Cape Town, did my pediatric ophthalmology, and came back. And then came back to Kikuyu in 2006 to December to start the retina unit, which had died because there was no retina surgeon. And there began my journey. So that's kind of a very, very abridged version. But it's been a journey that is a journey of faith. I just trusted God and did what I thought I need to do, and not because there was provision or because it was easy. It was actually very difficult most of the time. But I thought, this needs to be done, and I serve a God who is able to do everything. So let's start the journey, and he always came through at every stage of that journey. And so I've been practicing ophthalmology now since 2006. And there's another story on now my journey after I came back, which I guess we can discuss later. Thanks a lot.
Thank you. Thank you, Dr. Kibata, for starting us off on a good note. So I'll go to Dr. Patrick Mbuthia. How has your journey been from med school? Why did you even choose medicine and not any other course? And how has it been to where you are right now?
Okay. Thank you all for tuning in. It's a pleasure to speak to all of us. When I was in high school, I never imagined I would do medicine at all. I was more into tinkering things, engineering, architecture, sort of things. And indeed, when I went to the university in 1996, I actually joined architecture and studied there for a whole year. Towards the end of that year, I felt a very strong conviction that I need to change career. Not because I hated architecture per se, and not because I really knew what medicine was all about per se, but I just felt a strong conviction to go and study medicine. And so when I reported for second year, I went straight to the university and told them I want to change. Of course, it's a very difficult thing if you don't use the first 2 weeks to change course. So I spent about 2 months shuttling between offices at the main campus, which culminated in a meeting with a panel of psychiatrists who just wanted to know that I was okay. And so after 2 months or so, I got a letter saying that I've been moved to medicine. And the amusing thing is that the letter reads that you've been changed from architecture to medicine on medical grounds. And so I went home and came back to the university when my colleagues who we had started with initially were in third year. So I started first year in medicine, and as God would have it, that was the time the years were 5. So fortunately, I was able to pass through all of them. And so I sort of lost a year. And then after that, I went for internship in Nyeri. That is 2004. Got married in 2005 as a medical officer. And worked a bit until 2008, went back to medical school for general surgery master's. Finished in 2012 and was sent to Loitoktok as a surgeon and medical superintendent. After about 8 months, I went to Mukurweini for 2 years, again as a medical superintendent and the surgeon. And then after that, I got an opportunity, which I'm grateful for, through the CMF, to go to South Korea for a urology fellowship. So after coming back early of 2016, that's how I started working as a urologist, and worked in government for about 2 years, and then went into private practice. And then I think we'll be talking about the hospital that we run, and what it takes to just start something like that, and the challenges and the good parts about it. I think when I went to South Korea, I left my family also for that whole year. When I came back, my son couldn't recognize me, my youngest son. And then after about a year and about 2 years, my wife left also and went to India for a year to study medical oncology. And so that has been the journey, a journey of just hearing God and quite a bit of sacrifice at family level, and also just leaving country to go and seek further skill. Asante.
Thank you, Dr. Mbuthia, for that. So I'll just be pulling in or mentioning in some of the things that you're learning as we go. So our two speakers have mentioned one big thing: hearing the voice of God. Dr. Kibata has mentioned he had the voice of God, and Dr. Mbuthia has said that he had a deep conviction and he had a voice of God. So this is something that we need to think about, and also the role of family in all this. So as we go deeper, I'd like us to know about your journey as an entrepreneur, because we are never taught about entrepreneurship in medicine school, but to some level, we have many people, professionals or healthcare professionals within the entrepreneurial space. So I'll start with Dr. Kibata. How has your journey been as an entrepreneur? Was it hard starting? Was it easy? How was your journey? We'll just start from a general point, then go to the nitty-gritties of it. Karibu sana, Dr.
Kibata. It's not the easy option. Definitely, it is not the easy option by any stretch. And for me, I never considered myself as an entrepreneur really. But the way it started is because I had seen my dad go blind. I knew what blindness looks like from both a personal level and a professional level. I had seen my dad not being able to eat, couldn't drive, he couldn't inject himself because he was, type 2 diabetic. I had seen the stress at home, the depression, the anger. And so I was quite convinced that, this is the one thing I want to deal with. I was very clear that this is what I want to deal with. And that was formed and resolved. There was no doubt about that. This is what I wanted to deal with. And I was very single-minded about that. And I don't think I can say it was God's call. I think it was more, Lord, there's a problem here, I want to deal with it. Equip me and resource me. And that's what he did. So when I came back in 2006 and started the retina program in Kikuyu, I was sending away more than half of the patients because they were blind. It was too late. They were just coming to me too late. And I just saw my dad every day in that clinic. And I, at some point, I really got fed up. And I said, look, I don't think this is what I trained to do, to just watch people cry, tell me how they cannot go blind because they have mortgages, they have kids in university, they have this, that, and the other. And so I started thinking, how do we solve this? Because I saw a problem, a real big problem, and no one was doing anything about it. Everybody was saying government, government. And I thought I really must do something about it. So I thought every diabetic has an encounter in a diabetic clinic somewhere. So I thought the best thing is to see these diabetics in the diabetic clinic, screen them before they go blind. So that seemed a good way to deal with the problem. But then I was a full-time employee of Kikuyu. I didn't have time for this thing. How was I going to fund it? And so on and so forth. Then there was also now a second problem that was developing for me. I had been to India, Germany, you know, all these places. I was now a member of all these societies. So when patients went out, they were then sent back and told, go and see Kibata to follow you up. And they would come to Kikuyu and spend the whole day just sitting there doing nothing. They would have gone to the UK or South Africa. They would have seen the ambience and the facilities and the, you know, how the place looks like. And then they would come to Kikuyu and just wonder, what, you know, where have we come from? So there was also a problem now of patients, one, wasting time, two, feeling that this place is not up to standard, and they were willing to pay a premium. So I suddenly realized there was also another market of people who were willing to pay a premium to receive first-class care, but that care was not available. So one day, a bulb lit in my head. I thought, you know, let me start a clinic for these guys, and from the money I'll make, then I'll fund my outreach. Because the primary, what I really wanted to do is outreach. So I sat down for a whole year. Through connections, I learned there was a program, you could buy it off Amazon. It's called Business Plan Pro. I bought it. I sat down for a whole year in my bedroom. After everybody goes to sleep, I would sit down and write this business plan. And I wrote it for a year. And then there was a business plan competition run by World Bank, IFC, and a group from Netherlands. It was advertised in Nation. So I saw it one day. So I submitted my business plan. I said, I have nothing to lose. If I lose, they'll just leave me where I was. And then lo and behold, I won. Out of 900 applicants, I won. And I got a cash prize of $1 million. So that did two things. One, it made me realize actually what I had written made sense, that it actually can be done, because this was, you know, taken through a very, very rigorous process of both local guys and even international audiences. So I thought, okay, looks like I wrote sense. Maybe this thing can work. And then I had this lump sum of money. And in 2006, 2008, $1 million was a lot of money. So I thought, okay, I can start. So I came to Upper Hill Medical Center, found space, started the clinic. It wasn't enough, went to the banks, went to all the banks, and none of them gave me money. Despite winning a business plan competition and being given cash prize, and the business plan was by World Bank, that was not enough. They didn't give me money. So I said, okay, I'm going to buy equipment. You can charge the equipment. They told me, what's that? You know, tell us about buses and cars and houses. Asset finance is not about laser. What's that? They couldn't understand those things. But by God's grace, one of the banks, the manager had an eye problem, and they have had an eye problem, all the whole family. So she said, you know, I understand what these guys say. You guys may not understand it, but we have to fly out to get these services. So may I understand what this guy is saying. And on her life, on her job, she signed. She said, look, if this guy does not pay, I will agree. She actually guaranteed me without knowing. And this is somebody I did not know. And I really get shocked about that whole story. But the bank gave me money on the strength of somebody, a staff who said, I believe what this guy is saying and we should give him money. So I got a small loan. Then after that, because of that business plan competition, I had a line of investors who wanted to come and invest. I wasn't too keen, but I got a group from New York called Acumen Fund who came and said, we like the outreach bit. This clinic, we don't quite understand. I said, well, you sort out the clinic, give me money for the clinic, I will do the outreach. So they gave me a loan. It was in US dollars. It was a lot of money then. It was $200,000. Based on nothing, just an idea and my word. I said, look, I don't have anything. I owned a small Toyota car. That's all I owned. I said, look, believe me or please leave me alone. So they then lent me the money. I was supposed to pay that money in 4 years. We started the clinic. And as they say, the rest is history. And so we started the outreaches. We went to government hospitals. We spent many, many days on the roads. I used to run my clinic half the time. Then half the time I would be in Nyahururu, Kiambu, Naivasha, Meru, Nyeri, Kirogoya, Nakuru, everywhere, just sorting out diabetics. But it quickly became apparent that actually diabetics are not going blind from diabetic eye disease. They're going blind from cataracts, which I didn't know. And I was shocked because I thought cataracts is such an easy thing to deal with. Everywhere I went, I found most of the diabetics were blind from cataracts. So now I found a second problem which needed to be solved. So now I'm thinking, oh man, my private clinic is not designed for this kind of work. This is a mass market. They can't afford much. My waiting room had 10 chairs. I can't bring them in. Now what? So one day again, it occurred to me, if you're going to solve this problem, you need an eye hospital. You cannot solve this problem with a small clinic. You need an eye hospital. You need a hospital that is training surgeons, because you die on the roads if you continue this kind of lifestyle and lose your marriage at it. You need a place where you can charge a fee that these guys can afford. And it's an eye hospital. So we started praying. I told my managers, you guys, we need an eye hospital. We are going to solve this problem within that. So we started praying, just literally praying, Lord, we need an eye hospital. Show us what we need to do. And June 15th, 2015, we started our first eye hospital. It's on Gong Road, opposite traffic. It was a proof of concept because no one had ever started an eye hospital on a business concept. Lions is grant-based, Kikuyu is faith-based. No one had really started an eye hospital purely as a business. So we weren't sure it was going to work. But we said, Lord, we are starting because there's a problem. We want to solve this problem. We are starting. You lead us, teach us, show us what we need to do. And by 2 years, it had broken even. And we knew that this is what needs to be done. So at that point, I got an investor. He bought 30% of the company, put in quite a bit of cash, which was long-term debt. We bought the property, we re-equipped the hospital, we employed staff. We've just built our second eye hospital. In fact, we are Mbuthia's neighbor in Nyeri. We are opening next week. We'll be opening an eye hospital in Nakuru. We want to open another 4 or 5 in another 2 to 3 years. And that's my journey. I haven't told you the number of times I cried, the number of times I almost gave up. But generally, so that's been now my journey after I came back. Yeah, thanks a lot.
But don't worry, we'll revisit that. 2 things that you have mentioned that you will revisit in the upcoming questions. You've mentioned something important about finances and how hard it was just going through the whole journey. That for sure we'll be revisiting. So let me go back to Dr. Mbuthia. I've loved how Dr. Kibata has said that he never looked at it as a business, and that's because he was solving a problem in the market. Was it the same for you? How did you start your own private practice?
Okay. I think generally entrepreneurs are fairly restless people. They are difficult to keep in one place. And that's a good thing, because then they're able to look at things from a very different angle. But it also can be an Achilles heel, because you can jump into things without giving much thought. But having said that, I think entrepreneurship generally is defined as fellows who create value or extract value. There's 2 things about bearing risks and perhaps enjoying the rewards. But I think from where Dr. Kibata, sits, and myself, and it's good we are now becoming neighbors in Nyeri. It's about seeing things a little differently in terms of what are the needs at the very basic level. Because many times we have huge conferences that talk about healthcare and so on. But I think each of us in this group here can actually have a meeting with yourselves and ask yourself, what are the real needs that you see on a day-to-day basis? When I studied in South Korea, I was very impressed by their work ethic. Their work ethic is something out of this world. And whenever we talk about the Asian tigers, I think we forget to mention the work ethic that they have. And so we had I trained in this hospital, Severance Hospital, that used to do about 250 to 300 surgeries a day in different departments. And it suddenly hit me that when you boiled it down to individual departments, like in urology, for example, there are about 3-4 professors, a number of registrars, a number of nursing practitioners. It's a smaller department, and yet the amount of work and delivery they used to do was amazing. And so when I came back to Kenya, it was very, very difficult for me to accept the level of urology care that I was seeing. We had patients on what are called catheter clinics. You have wazir staying on catheter for a year, 2 years. They're just coming every 2 weeks to have a catheter changed, getting strictures, infections, and that kind of thing. And so when I worked at the government hospital, there was the issue of machines. Of course, urology has got quite a bit of equipment, lasers like Dr. Kivata is talking about, scopes, and also those kind of things. That equipment took very long to even convince the county government that they need to buy. And so for the the 2 years that I worked there, every theater day of mine, my car would be full of my own rudimentary equipment that I had bought with the little money I had. And I would literally go and set up the towers and so on and just do the things there. And so after some time, NHIF came up with this program for surgical packages. And what ended up happening is that I would see patients at the government hospital, and because of inefficiencies there and just the sheer number of patients, they would take another month, 2 months, 3 months before we could even get theater space for them. And after if I saw them privately, using the same NHIF packages, they would actually be sorted out in a week or 2. And I can say here, without contradiction, that I used to give as much time as I would in the government hospital. It's not that I was, shuttling patients away. And so it hit me that I was helping more patients privately than at the government hospital. And so when my wife was in India, I told her I'm going to quit government. And by the time she came back, I had already burnt that bridge after working for government for about 15 years. So you leave with a small, the only letter that you have is the one of resignation that you write. And so that was me. I went out and started seeing patients and working I did a lot of work at Jamii Hospital in Karatina. So all my patients, over 90% would go there based on the NHIF packages that were there, and would basically do the TRPs, ureteroscopies, and what have you. And patients, your tea farmer, coffee farmer, would literally just walk in and out. Now, the only challenge is that it is very difficult to convince hospitals to invest heavily in the kind of equipment you need. And after some time, it occurred to me that the only way of delivering the kind of urology care that I needed was to actually start a center. And so the idea of birthing a hospital came up. It was clear to me that I didn't want to do a general hospital. One, I had run 2 government hospitals, and I sort of knew the difficulties and the challenges there. And so we said, you're going to go straight into surgery. But then it also became clear to me that you can't, for the kind of numbers we have, maybe in ophthalmology it's a bit different. But whereas I could run a urology center, I felt that the kind of equipment you need to stock a good theater or theaters may actually be useful if you allow other doctors to come and work. And that is how our hospital was born, at least in the mind. Olive Hill Surgical Center, we didn't have a building of our own, so we leased an old Asian home next to the PGH in Nyeri, and refurbished it. And we were able to get 26 beds and 2 theaters and 3-bed ICU and so on. So where did the money come from? We basically staked out all our savings. I got a friend of mine, an orthopedic surgeon, who bought the idea, and we started renovating the building. Halfway, we were short of money. So we had spent every coin we had, and we weren't moving forward or backwards because now we didn't have money. And so we, as usual, as Dr. Kivata says, you walk into the bank wearing a nice suit and a tie and looking all serious. And you talk to these guys and you discover they don't buy your idea. You try and show them 4 years, 5 years of work as a consultant, and you're saying you're combining this effort, and they don't take it. And that is how banks are. Someone once told me that banks are not in the business of risk. It's not their business to risk. It is the business of the entrepreneur to risk. So you'll believe in yourself only. The bank will not believe you. Unless, of course, you get an angel like Dr. Kibata did. But so we were at a point where we were getting stuck, and I called some of the consultants in the area and told them, look, for those of you who are in surgery, I think this is a beautiful idea. We projected earnings and so on. I said, whoever is willing to buy into this and completing, please come, let's finish and start. And so after a bit of back and forth, we got 2 friends of ours, a neurosurgeon and an ENT, to put in some money. And that's how we finished the facility. We did not get credit at all, other than the credit we got from some suppliers who gave us beds and that kind of thing. Fortunately, now I think we are done paying them. And so we opened in 2020, in April, in the dip of COVID. And for 1 year, we didn't have the NHIF that we had hoped. And so we used to do about 5 to 10 surgeries a month. And you see, a hospital has to run. You have to have all the complements on nurses and kitchen and lab and what have you. So we were basically living hand to mouth, so to speak. Every patient who came who had to be a cash patient, all the money went, to meeting this needs. And so 1 year later, that is June of 2021, we finally got our NHIF approval. And by that, I mean other insurances would now allow to come on board. Because of our model, where we are not just looking at figures in terms of charging patients huge money, just using the same packages and people coming for TRP or brain tumor or hip replacements, or we have been able to do quite a number. I think as of last week, I think we've done about 1,300 surgeries. And these are basically fairly major surgeries. We do all arthroplasties. We do all sorts of neurosurgery. Right now, I think we've got one of the best operating microscopes in neurosurgical operating microscopes, which was a gift actually to the neurosurgeon because of the kind of work that he did in the UK when he trained there. And so the journey of entrepreneurship, I would say in a nutshell, capital for me should be your last consideration. Because if you think about it, it will kill a brilliant idea. Just go for it and believe it yourself. If you don't believe it yourself, you will get lost along the way. I think capital generally will follow ideas. It is not always a linear path, but ultimately, if you hang your neck out there long enough and push and have faith, God is going to answer you one way or the other. And I think as much as people push entrepreneurship as a way of creating value and earning money, I think what you can hear the 2 of us saying is that if you're actually out there to go and touch people's lives, God will back you. I think that's all I would say at this point. And we are still growing. We would pray to grow into a much bigger facility. But the model we'd like to use is that one that is based on answering specific needs. So if we're going to go for a full hospital now and we wanted to do, say, cardiac catheterization, I would have to get a cardiologist to put their skin in the game and say, look, I want a cath lab. This is what I would like to do, so that we grow those departments with a sense of ownership from different people. And that's been our journey, and we are grateful that lives are getting touched.
Thank you, Dr. Mbuthia, for that. So 2 things that I'd like us to linger on for a minute or 5 minutes. So you've mentioned, both speakers have mentioned 2 things, identifying the niche. So for Dr. Kibata, he identified the niche through a personal experience. And for Dr. Mbuthia, he identified the niche after coming from a well-developed country to Kenya and he realized that the system is not doing so well. So I'd like to pose two questions to our speakers. You're having a doctor out there, or a pharmacist, a nurse, just a healthcare professional who is probably frustrated in their healthcare center. What advice would you give them when it comes to identifying the niche? We have heard from your experience, but if there's anything else that you can mention around that, you're really welcome. And number two, the healthcare professional has identified the niche, but then the issue is finances. So Dr. Boothia has mentioned that if you're out, I quote, if you're out to help people, God will back you up. So you are out there and you're frustrated that this idea is really not working out. Maybe a word or two for our members who could be going through that, just to help us through this phase. So we'll start with Dr. Kibata. Just you can mention a point or two on the two questions, then we move to the next. Karibu.
I think it's important to note that both of us, Boothia was already a urologist and had worked for a while. And I was already an ophthalmologist, I had worked a while. And so when we talk about, at least when, and I'm listening to him, when we talk about the problem that we're trying to solve, it's not an abstract thing. We're very, very clear and very, very sure of what the problem was. And I think that's one thing that I need to emphasize, that you have to solve a problem, and that problem must be real. It can't be imagined, it can't be theorized. You can't be saying, I think, or somebody else said. And that will be teased out by you working. So you need to enter the field and work, and then you'll begin to see the problems. Fortunately or unfortunately, in the Kenyan health sector, you don't need to work very long to see those problems. There are so many. You just pick one and solve it, and you'll be, there are so many problems that you're spoiled for choice on which one to solve. Unfortunately, we spend time complaining instead of seeing opportunities. Every problem in the healthcare space is an opportunity. And we must change our mindset and say, okay, this is a problem, but this is an opportunity. For me, the fact that diabetics were going blind and nothing was being done was an opportunity. From Boothia, he discovered that he can solve this guy's problem outside. So there's an opportunity there. So that's one. I think it's very important that you don't aim to make money. You aim to identify a problem and solve it. And the bigger the problem, the better. Because it means the market is big. You have many more people who need that service. But you've got to figure out how they will pay, whether they are able to pay, and whether they are willing to pay. Because the other thing about Kenyans, just because you're able to pay doesn't mean you're willing to pay. Those two don't follow each other. So you've got to figure out, this is a problem, this is my solution. Can people afford it? And how will they afford it? How will they pay? But I think identify a problem, and the bigger the problem, the better. You may not be able to solve a big problem, but start with a small one. And you may not have to start a business. Solve a problem in that place where you're working. Let's see, first of all, whether you can solve a problem. Learn how to solve problems, because when you're out there in entrepreneurship, you will be solving problems. So teach yourself to solve problems, to navigate people, to navigate roadblocks. If you can't do it there, why should you be able to do it out there? So the second one is, and I say this with absolute confidence, money follows opportunity. Money will always follow opportunity. And let me say, especially to the young guys, and this was a shocker to me, I have dealt with many, many investors in this country. And the common complaint among investors is that they have money, but they do not find good health opportunities to put in that money. In fact, in this Nairobi, as I speak, there is more money than you can use. The problem is the opportunity, because every investor or every person who wants to put in money, even if it's a colleague, they want to put in money knowing that that money is going to grow. You are creating an opportunity. So if you create the opportunity, money will always follow. So like Boothia said, money is not a problem. When we are young, we think money is the problem. But no. Or the opportunity is the problem. Create the opportunity and money will follow. Over to you, Mbuthia.
Yeah. So when you're looking at opportunities in healthcare, the word niche comes often, or even in opportunities in different places. But if there's one place where you may not even be looking for a niche per se, a niche is like a special product, a special something that you're making that not many other people are doing. The fortunate thing about healthcare is that even if you are to talk about providing healthcare at the basic level, in the sense that if it is sorting out diabetic patients, sorting out eye problems, sorting out urology issues, these ones are across the nation. And so you don't have to look very hard to identify what the product is. I think if you ask your common Mwananchi, what are the biggest problems they have in terms of healthcare? It's about access, it's about efficiency. I think it's about just being able to present your problem and have it sorted in reasonable time. Because if you take many government hospitals, for example, problems do get sorted. I mean, if you have a fracture, it will be sorted out. But maybe it might be sorted out after it has already had a bit of malunion because of the time that it has taken. So when you're looking for an opportunity in health, it's about creating a system that is able to repair that fracture. If someone gets broken today, can we have it fixed by tomorrow, for example, or even today night? And that, for us, is the whole essence of the center that we run. We have tried to make it as affordable as possible, using the NHIF rates as the basic rates, so that even if a patient comes and they need to pay cash, we still end up charging them around the same rate. And so if you see someone today and say next week they are sorted out, then it's okay. And that's the business opportunity there. But for you to be able to move that direction, I think, as Dr. Kibata said, you have to really have a mind shift that is solution oriented. Because, when you work in a system that harasses you a little, it is very easy to become more of a complainer and see doom in everything. But if you work at solutions, even in that government facility in your county, it is still possible for you to be known as a person who, amidst all the challenges, you really have a heart for serving. And incidentally, if you do that even in the government hospital, even the day you get out there, some of that social capital will follow you. And I have seen that in my own life. I think what I would probably add, at least in my experience, the issue of getting people of like mind and collaborating is very important. Setting up Olive Hill Surgical Center, for example, we needed state-of-art theaters. And what that means that if we buy a laparoscopy tower, for example, alone, whether I buy it alone or we buy it when you're now the four of us, it will still cost the same. But if I set up a center and I buy a 10 million shillings equipment and I only use it for urology, even the rate of return doesn't make sense. If we equip the theater, for example, and the guys doing arthroscopy, the guys doing laparoscopy, the guys doing cystoscopy are using the same cameras, same light source, and same, then you spread that machine across and it makes more sense. So for me, I've seen that collaborations are important. And I know for a long time as doctors who were taught to work alone, perhaps because there were too few doctors in the country. But now we are quite a number. And I think if you do want to get somewhere, please just bounce your idea on the wall of a few colleagues and see how you can collaborate. Because setting up medical centers, for example, is not an easy job, even in terms of capital. But when you're more, the de-risking is there. You get more patients coming to use the same facilities. If you employ a nurse, the same salary you give the nurse if they take care of one patient or take care of 5 is the same. So I found that collaboration is very, very important. And that comes with its challenges, but that is what I would say for now.
Thank you, Dr. Mbuthia. I remembered a quote: if you want to walk fast, walk alone, but if you want to walk far, walk with others. So I'd like to invite Dr. Yulu to ask a question at this point. Karibu, Dr. Yulu.
I love the comments. And so maybe if anybody wants to ask a question, they can either just text in at the chat or raise their hand. And maybe to Dr. Mbuthia, he's perhaps touched a bit on this. My question was about group dynamics. I've had a bit of doctors collaborating together, and then that does not work out well. Maybe you could just touch a bit on that, how you would handle group dynamics within the practice, because I've seen that to be a challenge with other places. And then maybe to Dr. Kibata, the question I would have is, what is the one thing that having heard and heard about your journey, is there something that you feel could have made in retrospect, of course, hindsight is 2020, how nice to say that to an ophthalmologist, what would have made the journey shorter? Thank you.
Okay, I go first. Yeah. So group dynamics are very, very interesting. And this I say not just from my experience in running a hospital with colleagues, but also having chaired a number of investment groups, which are still running and doing other things in the real estate space. One of the most difficult things about group dynamics is that when you're in a group, many people make the mistake of expecting the whole group to think the same, to put the same effort. And so we have this group where people are basically looking at each other and wondering, why have I put X amount of effort and this other one is not even saying anything, even on the WhatsApp group, for example. But I would like to put it this way. Every group has got different personalities. And for example, we run an investment group that has got about 30 people in different fields. If we expected all these people to give us the same effort, the group would never move. And so even when you start a practice or a medical center or a business together with colleagues, quickly identify who among you is ready to sweat the blood. Because as much as a group is large, there's always one or two individuals who are the engine behind it. And these are the people who will spend a bit of sleepless nights, who will run around talking to suppliers, just sorting out the mundane and the everyday challenges of the group. And so if you agree that it is you that has ownership of the group per se, just be ready to put in a little more effort. And don't be too hung up thinking about why is so-and-so not so concerned. Remember that like we all have different personalities. There are people who will follow more. There are people who will work on tasks when given directly. There are other people who will think about how to move the group forward. And I found that group dynamics, one of the principal problems that cause groups to fail or common practices to fail is when everybody starts looking at everybody and almost measuring input. Remember that if you start something together, even if you put 50% of the work and the thing works, you benefit. If it fails, you all fail. So I would say the group dynamics is more about some people within the group taking more ownership than others and getting comfortable with that.
Thank you, Dr. Mbuthia. Dr. Kibata, karibu.
I'm trying to remember what was the question. What I would do differently, or hindsight. Oh, 2020. Yeah, no,
hindsight. Yeah, what would have made you? Yeah.
So when I look back, So I have had two journeys. I had the private practice, and then we had the eye hospital. When we started the eye hospital, we got a mentorship program from a very big group of eye hospitals in India called Aravind. In fact, it's called an eye care system because they are so big. And so they took us up and mentored us and trained us. We visited India many times. They visit us. In fact, as we speak now, there's a group of senior consultants from there with us for 2 weeks. And because of that, we have achieved a lot in a very short time. And so what I really, when I look back, I wish I had mentorship when I was starting. I think I would not have wasted time in many things that I did. But I did not have. I was charting my path. It's like a surveyor in a bush. You cut the bush as you put the beacons. And so I think mentorship is a very important thing, even for the young colleagues. Get a mentor. It will help you navigate things. You have somebody to bounce off ideas, and you'll have somebody seeing what you're not seeing. I think for me, that is one thing that that would have helped. The other thing would, I wish I started the eye hospital straight, because I think would have done so much. But in retrospect, maybe the reason I started the eye hospital is because of the experience I got from the private practice and the outreach program. Maybe if I didn't have that, then I wouldn't know how to. So that I'm not very sure about. But mentorship, I'm sure about. I think it's important to, especially if you're going into a journey that you've never been before, get somebody who's been there to work with you. Yeah.
Thank you for those two answers.
I'm sorry, Lydia.
Mm-hmm.
Can I just have maybe one of them react to these two, because they seem to have, so maybe Dr. Bhutia, GDRAF is asking whether you think exposure abroad was key. And Jafeth Kamau is asking about the equipment. It's a long text, but the gist of it is putting up the building is expensive, but may not be the most expensive. So the question is, how do you go about the equipping? Things like CT scans and so on and so on. Maybe while at it, I don't know, I don't want to preempt, but maybe you could talk about the role of placement as we know it, of such. So, Dr. Go.
Okay. The issue of exposure abroad, I think both of us have had that, and I'm really grateful that that happened. What exposure going abroad or working in a different country does, especially a place that has high volume and fairly advanced equipment, two things. One is the work ethic. I think a work ethic is very key, and sometimes depending on which medical school you went to, which hospital you went to, like even across the country, different hospitals have different work ethic, by the way. With the same equipment, same difficulties in government, same challenges, same good things, people deliver differently. And so when you go to a center where people just work and things are done efficiently, you don't create reasons for bouncing patients off theater lists and so on, you don't remain the same. You come back feeling, no, there has to be a different way of doing these things. So I think that exposure is important. And also, you also get to demystify a lot of things that you read in books. Like in neurology, for example, we have robotics, quite a bit of robotics in prostatectomies and things like that. You only used to read about them. But when you go to a place and see it in real life, get trained and so on, you come back saying, there's no reason why we shouldn't get a urology robot in this country. And so I think that's what exposure does. It sort of removes you from what you know and shows you, like you take, say, a textbook and see a certain author, and then you happen to go to a country and meet him in person, working. And you suddenly see this is flesh and blood, just like you and me. And so these things are possible. I think it basically expands your horizon in terms of the possibilities. And I don't know what Dr. Kivata's experience is, but some of the places you hear being called the world eye hospital or something like that. Sometimes when you go there, you get surprised at how not basic in a bad way, but how doable, something is. That it's not about size. It's not about fantastic buildings. It's not about all sorts of things you'd have formed in your mind. Just go and find fellows who are committed, working in a very kawaida place, but the kind of output they are giving, is really encouraging. And that, for me, was an eye opener. It was very important that I was able to do that.
There was one more about the equipment and infrastructure. And then as I finish, maybe Dr. Kibata can also answer one by Christine about how long it took to break even. Thank you.
Okay. I think hospital equipment, that's a big one in two ways. One, they are very expensive. And two, you have got all sorts of providers. And three, hospital equipment, you have to be very clear what it is you want. For us, for example, when we opened our center, we had imagined that we might want to do CT scans, and we even made one room ready, putting lead on the walls and so on. And then we said, wait a minute, why do we want to spend 20 million shillings, which we don't have, on a CT scanner when we've got about 3 or 4 CT scans in Nyeri? What is easier? For example, a hospital doesn't even have an ambulance. We have outsourced that from St. John's, because you see, we take patients more on a referral basis. And so when we need an ambulance, we are taking a patient for an MRI or a CT scan. First of all, you have to define what really makes sense for your facility. Don't spend money just to be fancy, so that people say equal scan up or equal MRI. If in urology I need a laser, or Dr. Kibata needs a laser for his retina surgery, now that's a critical equipment. It doesn't matter how much it costs, he'll go for it. But does he need an MRI when there are other colleagues here who set up imaging centers? I think that collaboration and thinking is good. You must also be careful to try and buy fairly equipment in good order, because if you buy an old piece of equipment just because it is cheap, the downtimes and the kind of trouble it gives you is not worth it. I think the third thing I would say about equipment is there's a lot of equipment sellers, not just here, but even outside the country. And sometimes you find we want to buy a laparoscopy tower in about a week or so. And if I was to get one here, the newest series, it will probably cost me about 4 times the price. If I get a nice refurbished unit, say from the US, just a series before, it will give me the same kind of images, and I'll have spent about a quarter of the money. So when you run that business, you have to be very careful about getting things that you need and getting them at the price that really makes sense. Otherwise, you'll go into bad debt and you start losing your hair very quickly.
Yeah, so I was asked about how long it took to break even. So first of all, let me say, I learned what break even was about 4 years ago. I didn't even know what that was. So for my private clinic, I don't know because I never calculated. we ran a kiosk. There was money, we paid the suppliers, we paid the rent, we paid ourselves, and we were owed a lot of money, and life just went on and on. So for the private clinic, that one I do not know. But for the hospital, because now I know we broke even year 2, but the second year, 18 months there, we had broken even. But also that break even also changes, because break even is dependent on your fixed costs. And our fixed costs kept going up, because as we employ more staff, as we get more space, our fixed costs have been going up. So break even also changes as you expand. But we broke even by the second year. So the first year of the hospital, all the employees were being paid from the private clinic. The payroll was being run by the private clinic. So I was earning money to pay the staff, pay myself, pay everybody, until at a certain time when we could move now the staff to the payroll at the hospital because now we had started making money. So that's how long it took us. Yeah.
Thank you for those pointers. So we're almost coming to an end. I'd like us to finish with 2 questions. Is there really a balance in medicine, or it's something that's not there? Then number 2, is there a place for personal branding? You know, we are in a social media era where we put things online. At times we can speak, so and whatever we say is careless, especially for the young age. And maybe we are destroying ourselves for future opportunities. So these are the last questions. I'd just like to give each of the speakers to give us the 2 pointers. Is there space for what is the place of personal branding, and how do you balance when it comes to family, specifically family? Let me start with Dr. Mbuthia. Karibu.
Okay. Great. I think work-life balance is a must. Otherwise, you'll lose very important part of you, which is family. You have to define what it is you want to do in terms of practice. So if I was to give a practical example, here in Nyeri, I run a private clinic where I see all my patients, and also I do theater. So the way I've worked it out is I do my clinic twice a week, which is Monday and Thursday. That sounds like a few days, but what I discovered is that you also teach patients how you want to them to treat you. So if, for example, you're going to see, say, 30 or 40 patients in a week, you could see 5 today, 10 tomorrow, 15 the following day, 3 the other day, or you could actually make it clear that you're only available this number of days. And so on every one of those days, you see your 15 or 20, and then you free up the rest of the week. And so what happens is on Tuesdays, I do my surgeries, and they can stretch anything from 7 in the morning to midnight if it's really heavy, or generally to around 6, 7. And so what happens is that when I'm in the office, I will not go to theater unless it's really an emergency. When I'm in theater, I will not go to the office. And so what happens is patients learn to respect that. You also become more truthful, because when you have a queue of patients waiting at the office and you're stuck in theater, and the secretary has to do a lot of public relations and tell them, Daktari is on the way, give him an hour, and then you have a bleeding patient in theater, you start getting worked up. You're trying to finish this surgery and run to the clinic. So I think setting up that way, and because the clinic has generally grown by marketing of patients, and these patients have got to be happy, they tell their friends, you can see him, but he's only available on this day. And that has helped. And what that does is that it leaves you a bit of time in the week to do other things. Recreation, for example. For those of you who might play golf one time, it's an interesting place to be. It requires time for you to be able to go and talk to your children. And also, as an entrepreneur, especially if you are doing other things even outside medicine, those other things also require you to just have a mind that is a bit free and it's not necessarily in the hospital all the time. And so that has helped. I think I'll end with, so in terms of marketing, the best marketing is by your patients. You can do outreach as a facility. I don't think the law allows you to go out there and say you're the best gynecologist in town. So the people who can say that would be your patients. But in terms of the facility, that you can market as a business, just tell people what is available. I think I'll end by referring to Psalm 78, 70 to 72. It's one of my favorite scriptures. It talks about David the king, and it says he had 2 attributes that made him a good king. And one of them was integrity of heart. And with integrity of heart, he was able to shepherd the people. But with skillful hands, he was able to guide them. So as a doctor, as a pharmacist, as a medical worker, those are the 2 things I would really pray, that you get integrity of heart to be able to always be above board, touch your patients as God would, and also make sure that you've got skillful hands so that you're able to get good results, because those are the ones that will speak for themselves and for your institution. Asante.
Thank you, Dr. Mbuthia. Karibu, Dr. Kibata, you can comment on the two and also give us your shot. Any questions, kindly post on the chat. Karibu.
We did, from the time we started the eye hospital, we do exit interviews for new patients. So all new patients fill a form and say how they got to know about us. And when we started, we had somebody who was very, very excited about what we're doing and sponsored billboards. One was on Jogoo Road, one was on Thika Road, just that Thika Road, Kiambu, Muthaiga Junction, and one was on Jogoo Road just after the stadium. And there was another one on Mombasa Road. And for the 3 months, those things were up. Only 5% of the new patients came because of billboards. And we have seen, we even have somebody now full-time on social media. That statistic has never changed. Over 90% of our patients still come because they were referred by a friend or a relative. And that's how medicine works. Medicine is a trust, especially in this Kenya. And especially at specialized level. Maybe at general level, it doesn't, even at general level, there's, but maybe that's a different dynamic. But people go to see doctors because of a referral from usually a relative or a friend, or either in a club or somebody, and so on and so forth. The other day, a man came and said he's in Railway Golf Club, and he said he posted that he has an eye problem, and my name came up from 3 different people in that WhatsApp group. So he figured whoever I was, you need to come and see me. So I think we have found that the best marketing for the doctor is your work, but also your bedside manners. There are patients who come here and say, we come here because of your bedside manners. Greet people, give them time, listen to them, find out what they do, treat them as human beings and genuinely care. Very, very important. I was going through a training the other day, and it says trust is based on 3 C's. One is character, compassion, and clarity. So develop trust, and to develop trust means how you treat patients. Treat them well, treat them with respect, treat them with compassion, listen to them, go out of your way, and don't discriminate. It doesn't matter who it is. Treat them as God's creation, because that's what they are. In terms of work-life balance, very early on, once I went into full-time practice, I had a dentist who never used to work on Wednesday afternoon, and it really intrigued me. And then I realized, actually, you need a day off to just, be normal. So I stopped opening on Saturdays, and some of my colleagues laughed at me and told me, Saturdays are the busiest days. How can you not open on Saturdays? But I decided I will not work on Saturdays from very, very early on. Otherwise, I would lose my wife and my kids. And I really have never worked on a Saturday unless in very exceptional circumstances. And that helps me to just be grounded. But we work long days. We work 7 to 7 on weekdays. But on weekends now for us, we don't open. And I agree with Mbuthia. I have my clinic days, and my clinic days I don't go to theater, and I have my theater days, and my theater days I don't see patients. And that's how it has worked. There's somebody in this group called Dr. Gishohe. Dr. Gishohe is the head of department at ophthalmology. And I want to call him out because a lot of who I am is because of him. And I'm saying this because of that whole issue of mentorship. If any of these people here in this group want to do something, please find somebody who you can work with, talk with, and because for me, Dr. Gishohe has been instrumental in who I am in many, many, many ways. What was the other question? I think that was it.
Yeah, there are the 2 on branding and work-life balance. And maybe a parting shot from you.
So I want to read, when I came back from Moshi, there's a verse that God gave me. It's in Proverbs 22, verse 29. It's the last verse actually in Proverbs 22. It says, do you see a man skilled and diligent in his work? He will serve before kings and not obscure men. Do you see a man who is skilled and who is diligent? he will serve before kings and not ordinary men. And that has been my kind of ethos, that I absolutely need to be the best I can and the best that I am, and work hard. And the Bible promises that you will serve before kings. We really must be salt and light. You can't be the one who comes late and you're the worst outcomes and glorify Christ. There is no glory in that, in a poor practice. Thanks.
Okay. Thank you very much, Dr. Kibata and Dr. Mbuthia. So we've come to the end, and I hope that just by our two giants talking today, that we've been not only encouraged, but we've been inspired, and from here we shall bear fruit. Yeah, so I'd like to go to the next section, which is just announcement. It won't take long. Kindly don't leave the meeting. So I'll invite Dr. George Otieno to join us and tell us more about CMF, and at the same time, what is what you can look forward to in the upcoming months. You can unmute Dr. George.
Thank you, Lydia. I hope I can be heard.
Yes, you're very clear.
Yeah, we all probably know about CMF, so I won't mention so much on CMF, but I would just make a few announcements. Thank you so much, Dr. Kibata and Dr. Mbuthia, for that very inspirational session. I believe that we have all benefited, and we are going to use some of those tips to make life better going forward. These are very instrumental moments for CMF because we get a chance to learn from one another. I would just like to mention two things. We have our conference coming at the end of December, at the beginning of December this year, and we will be having our annual general meeting. And this time around, we have elections that are supposed to be conducted for some positions. There's an email that has gone around. Please send names for nominations for that particular election. These are the people who will lead us and help us to chart the way forward for the organization. So please take part and be active in that process. And then number two is that we have seen a lot of need for standing with each other during the end of life situations, like when we lose loved ones. And we have decided as an organization, through the participation of members, to come up with an end of life cover, which is basically a group cover that enables us to take care of our families when we have lost our loved ones. And so we have also sent an email towards the same. Please feel free to look through the rates and send an email to the office on your details and also the group, the option that you've picked. It is through a united front that we can be able to conquer a lot of the challenges we go through in our lives. And we hope that members will be interested in both participating in the options offered and also bringing up thoughts on what are the ways CMF can act to ensure the welfare of members. Thank you very much. Back to you, Lydia.
Thank you very much, Dr. George. Just to emphasize, we are having a conference in December from 2nd to 4th, and we're really looking forward to host all of us in this meeting and even more. We've been 60 plus of us, almost 70, because there are some that joined in groups, and there'll be more of these conversations going on. And then next month, around the same time, we'll be having a third pre-conference in preparation for the conference. This was the second one, and that one will be talking about but seek ye first. So now we switch gears to seeking God more. Yeah, just to thank each and every one of us for joining in from, I've seen Dr. Lydia from Melbourne, I've seen someone from Kakamega, I know there's some who joined in from Naivasha. Thank you so much for joining, and karibuni sana. So I'd like us to have a closing prayer. I don't know if I can pick Dr. Wichuli to close for us. Dr. Wechuli, are you in a position to pray? Okay, sawa. So let me go back to Dr. George since he spoke last. Kindly close for us with a word of prayer.
Okay, thank you everyone for attending, and let's pray. Father, we thank you because of your faithfulness to each of us. We thank you that we can gather together as your children to learn from each other, just as iron sharpens iron. Lord, we thank you for the wisdom that has been shared this evening through Dr. Kibata and Dr. Budhia. Thank you for the courage that they have had to venture into new fields and to be able to do something that makes an impact in this generation. We continue to pray for them that you'd increase them and cause them to be a beacon and an icon that we can all look to and that will bring glory to your name. We also pray for those of us who are desirous of conquering nations, just like they have. We ask that, Lord, you'd continue to give us insight and wisdom and guidance as we plan and think and as we come up with ideas. Send to us, O God, men and women who will mentor us and who will walk with us through the journeys that we will choose to make in our lives through your guidance. And we bless you for CMF as a body. We ask that, Lord, you'd use this institution to cause each of us to be molded and be shaped in a way that brings glory to your name. We give you praise and we honor you even for the remaining programs. We ask that you guide us and lead us for your name's sake. In Jesus' name we pray.
Amen.
Thank you. Appreciation to Dr. Kibata and Dr. Mbuthia. May God bless you. And the meeting has been adjourned. Asanteni.